The Smart Plug from Medenium, a flexible thermodynamic hydrophobic acrylic punctum plug designed to fit and stay in the punctum as an innovative treatment for dry eye, ultimately allowing for an increase in tear film retention while providing maximum patient comfort. The Smart Plug's smooth, simple design and ease of handling makes the insertion process extremely uncomplicated. The Smart Plug comes packaged 2 plugs per box, with each plug contained in an innovative carrier. To expose and then remove the Smart Plug from the carrier, simply squeeze the carrier base. This action will expose the top wing of the carrier. Next, twist back the top wing of the carrier and continue to peel it back until it is completely separated from the carrier base. This will expose the carrier channel. Now, grasp and squeeze the carrier to expose the Smart Plug. Using the Medenium Smart Plug forceps, model 502, align the grooved end with the Smart Plug, gently lifting it from the carrier. Once the Smart Plug has been successfully removed, it is ready for implantation. If the medical history of the patient reveals prior use of plugs or surgical closure, it is recommended to check for punctopatency to verify the absence of obstruction. Once this is done, the Smart Plug is grasped with grooved forceps and the patient's lower lid is depressed to expose the lower punctum. And at least 2/3 of the Smart Plug is directly inserted into the lower punctal opening, leaving 1/3 of it external. Keeping the patient's lower lid depressed, the Smart Plug can be observed protruding from the punctum. The patient's body heat warms and activates the thermosensitive acrylic material. Changing the Smart Plug from a rigid 9mm cylindrical rod with a 0.4mm diameter to a cylindrical soft gel, approximately 2 mm in length and 1 mm in diameter. The thermodynamic action of the Smart Plug, from insertion until it is completely contracted into the vertical portion of the lower canaliculus, takes approximately 30 seconds. However, variations in eyelid temperatures may affect the speed of the solid to gel transition of the Smart Plug. An alternative insertion method would be to introduce Smart Plug into the punctum vertically, then nasally. In this slow motion view, the patient's lower eyelid is rolled down, exposing the punctum. Smart Plug is introduced into the punctum about 2 mm. Once this is done, it is regripped and redirected into the canaliculus in a nasal position by rotating it 90 degrees. Smart Plug can now be advanced directly into the canaliculus nasally, and no more than 2 mm of the plug should be exposed. Due to its thermodynamic properties, any portion of the exposed plug will then gently retract into the vertical punctum. It is important to ensure that during the insertion, patient blinking does not displace Smart Plug from the punctum. If displacement occurs, simply advance the plug back into the punctum. Smart Plug can easily be inserted into the upper punctum using the same techniques. The Smart Plug has been developed to accommodate to the natural size of the punctum, providing complete occlusion. If necessary, however, the Smart Plug can be easily removed by irrigating it out. The Smart Plug from Medenium, a flexible thermodynamic hydrophobic acrylic punctum plug designed to be a simple, safe, and effective device for punctal occlusion and the treatment of dry eye. The Smart Plug from Medenium, providing ophthalmic patients with a new way of seeing.